The government will begin covering part of the cost of long-term nursing care, which is currently excluded from the National Health Insurance System under a health ministry plan set to begin in 2026.
정부는 2026년부터 시작될 보건복지부 정책에 따라 현재 국가 건강보험 제도에서 제외되어 있는 중증 환자의 간병비를 향후 부분적으로 지원할 방침입니다. All right, let's have a look at this story first then. Tell us what's going on.
So this is going to be great news for people who have need for long-term health care. If you or a family member have a serious medical condition and need long-term nursing care that is currently not covered by the South Korean National Health Insurance system. And so what the government is trying to do is starting in 2026, they want to try to cover some of these medical costs.
Right. And when we say nursing, we're talking about someone looking after, in this case, someone with an illness or an ailment. So it's a 간병인이 있는 상황, 간병인을 두고 있는 상황, right?
So it's not just a one-time thing like you're a little bit ill or you had a small accident. This is for people who need long-term nursing care.
Yeah.
You need somebody a little bit more full-time to come and help you with medication and with getting yourself better, getting yourself healthier. And so the government is looking at ways to try to cover more of this burden for people who are paying a lot of money out of pocket.
Yeah.
That means that they are using their own money to sort of to pay for these medical costs. And it can be very, very difficult for families to cover. So the government eventually wants to get this down to about 30%, so that people are only paying about 30% of the cost and the government will pay for the rest.
Oh, that sounds great. Now, what does long-term mean? Long-term nursing care.
So long-term refers to a longer duration of time. So when you have something that is extended, something that is maybe not permanent, but it could be permanent, but something that goes on for a little bit more of an extended duration of time.
In everyday conversation, we sometimes say, in the long term or in the short term, blah, blah, blah. That means if you look at it from a very narrow perspective, just within the next couple of days, this is the result you might get. That's in the short term, but maybe in the next couple of years or even longer than that. That's in the long term, right?
Right. So maybe your high school teacher might ask you, what are your long-term goals?
Oh, right.
Right? And so that could be maybe not right after graduation, but maybe what do you want to do
in life.
When you grow up. So in this case, we're talking about people who need long-term care. So just not like a one-time thing, but maybe many, many years.
Sure. I think for us this morning, our short-term goal is to get this show done properly.
So your goals for me are so low.
But our long-term goals would be other things, greater, bigger, grander things.
I just want to get through one story at a time.
that would be the short-term goal.
Right.
그래요. 단기적인 것과 장기적인 것을 얘기할 때 long-term, short-term 이렇게 얘기를 할 수 있죠. 장기적인 게 long-term이고요. 자, long-term nursing care를 최대한 더 많이 이제 보건복지부에서 커버를 할 수 있도록 노력을 하겠다. Currently, it's excluded from the National Health Insurance System.
Right. So currently, people who need this long-term care, their situation is excluded from the National Health Insurance System. To exclude something, you see the beginning of the word there, EX, that means to leave out, to omit. It is the opposite of to include somebody.
Right. To exclude. 제외하다. So currently long-term nursing care or nursing care in general, I suppose, is excluded from the 건강보험 제도 or the National Health Insurance System. However, from 2026, which is just next year, this will likely be covered. The government is going to cover it.
They're working on it.
They're working on it.
It still needs to pass like a policy review, a committee review.
Yeah.
But hopefully this will then be included in the Korean National Health Insurance policy.
Right. And patients will still have to pay some money, but not as much as before if the law gets passed.
Right. It won't be 100% coverage, but the government will try to cover more.
Exactly. 자, 다시 한번 읽어보겠습니다. The government will begin covering part of the cost of long-term nursing care, which is currently excluded from the National Health Insurance System under a health ministry plan set to begin in 2026. Let's move on to the next headline.